I ended up getting bit by a nymph tick 14 years ago out of Inskip Memorial Day weekend '99. And not ever understanding what a tick can do to you. My dad was raised in Minnesota, and so we understood the nature of ticks, you know, but I never thought that there were ticks here. And I ended up with a bullseye rash every month for 3 months, and I finally showed it to my friend because I started having like nervous system issues, like muscular issues. I mean, I'd walk down steps and just get really weak and fatigue and just feel real flu-like. And so I showed it to my friend, and she looked at me and she says, you know, you have Lyme's disease. And I said, well, what's that? And I'm a glass half full kind of girl. So I'm like, what's that? Oh, I got a disease. Oh, and something will kill it. I'll be fine. And so she says, no, Janell, you need to go to the doctor right away. And I said, oh, okay, you know, what doctor do I go to, you know? And she, you know, she recommended one, and I went, and they tested me, and the nurses saw the bullseye, and they said, oh, yeah, you have Lyme's disease, and my test came back inconclusive. I mean, it was borderline. And the doctor looked at me and said, no, there's no such thing as Lyme's disease. And that is that's a big made-up thing in this area. I've never heard of anybody having Lyme's disease in this area. And I says, yeah, but you know, we've done a lot of research on the internet, and we actually have somebody who has Lyme's disease who's very knowledgeable in it, and she agrees that I do have Lyme's disease. And I'm looking at the test going, it's only 4 points off from being positive. How can that be? And he says, no, there's no such thing. But he did recommend me to go to an infection specialist here in Chico. So that's what I did. I went and saw this infection specialist who saw the bullseye rash, and he says, no, you have allergies.
Was that in the same spot as you got bitten?
Yes. But I didn't realize that it was a tick, because I thought it was a little like a piece of wood, you know, like I got a little splinter. We were out camping, you know, so I just picked it off. I didn't even think anything of it. So I go to this infection specialist, and the specialist is telling me that I don't have Lyme's disease. And I looked at him and I said, that may be the case, but we've done enough research. I believe I have it. Everybody else around me believes I have it. I have all the symptoms that are coming on, and I want you to treat me as if I have it. And so he put me on a 2-week course of intravenous antibiotics, which after 2 weeks, when he pulled me off of them, the nurses at Enloe Infusion Therapy Center said, are you sure you've been on the treatment long enough? And I go, well, my doctor says I have. And I feel fabulous. And being, you know, only 30 years old at the time, you still feel a little bit infallible. You know, you could do anything, and you're feeling awesome now. That I didn't take them at their word, you know, because they can't come out and say that he's wrong. You know, so they were kind of giving me a gentle nudge. So a year later, all my symptoms started progressing again. 5 years later, I thought I was going to die. I was, you know, I felt I was going to pass out. Chronic fatigue was hitting me. I had joint pain everywhere. Nervous system issues, loss of memory. I mean, just horrific. So I ended up going to a specialist here in Chico that is very Lyme literate, and he tested me. And he said, yeah, you know, you tested positive. You tested positive for the bacteria for Lyme's, for ehrlichios, which is another bacteria, for cat scratch fever, and babesia, which is the parasite. And so he started me on a course of Mepron for 2 weeks, which looks like it's nuclear infused. It's like bright yellow, and it's very toxic. And so I went on that for 6 weeks. You know, the 2 course was 6 weeks. And then also a year worth of oral antibiotics and intravenous antibiotics. So I went through that, and I didn't feel great, but you can't stay on antibiotics forever. I'd read, you know, I'm a reader of what's going on with me, what do I do, how do I get well, you know, if I can take something over the counter that says it kills viruses and bacteria, I'm gonna do it. If it takes care of inflammation, helps your memory, I'll take it. And so that started my course on learning how to self-medicate without being on pharmaceuticals. So then to now. 2 years ago, I called my dad up and I said, I don't know what I'm going to do. I had a great job, was making great money, going downhill. I figured out the industry for me. I'm very sales oriented. I'm very people oriented, and I knew that I couldn't work full time, but I am good at my own time management. So I went into the insurance industry because it has residual income. And I'm like, when I fall down, at least my income's still good and I'd be, you know, good to go. And, but I couldn't even handle my small book. And I made it a small book on purpose. You know, I went after the right people, you know, to help with my income so I could have it manageable. And I called my dad up and I said, I don't know what I'm going to do. I can't work anymore. I can barely even function. I go home and I take a nap. And it's not like you just lay down and you want to rest. It's your body passes out. It's a, you know, and so I went through all of that, and it ended up being a ironic thing that my dad had a friend that had went to a place in Reno that has, it's alternative treatment. They give you a bacteria that gives you the flu to kill any virus, any bacteria. You know, your body's heating up to kill all these pathogens. But when you get done with that, you're so loaded, and it was, you know, 6-week course of this, having the flu every day. And when you get done, you expect, you know, oh my gosh, you're going to feel so good. But you've killed so many pathogens that your body's so toxic. And you're trying, you know, and they do all these other things. They're a wonderful organization, but I still couldn't get past go. I still had those, I'd have like a little reprieve of feeling good, and then I would be back to feeling horrible again. And then I would feel good, and then I'm back to horrible again, because they would want me to do a liver cleanse. And every time I do a liver cleanse, my body would go, ah, and I would be fatigued, and my joints would ache. And then on top of that, I found out that now I have a thyroid issue. Probably because my body's trying to slow down the progress of getting rid of all this stuff that's toxic to your organs. And I don't know if that's specifically true, but it seems to be logical to me. You know, if your body can't handle what's going on, it's got to slow itself down. Here comes the thyroid. So I ended up getting seeing a thing on Facebook for the thyroid situation. And I was getting ready to go back to Reno to talk to my doctor there about my thyroid. Well, going to Reno isn't inexpensive. I mean, the course that I went through was extremely expensive. I mean, my family shelled out over $15,000 in a 6-week period of time for me to go do that. And every time I would go back, it would be another $1,000 to $1,500 for me to go back. Well, I was running out of money and options. And so I'm like, well, you know, I believe everything happens for a reason. If this is where I'm supposed to go, that's what I'm going to do. So I called Shane up, and he calls me back and started our relationship 6 months ago. And it hasn't been easy.
You still got that car key.
When I saw Shane, I was at my wit's end. I really just didn't think that I could go through this anymore. I mean, I just wanted to hide under a rock. I wanted to be away from everybody, you know, because you can only take so much working hard, and then you just get biffed in the face again. But when I went to see Shane, he really put me at ease. We've created such a great rapport. And not only is, I understand the concept of getting your nervous system. Your nervous system is like, I mean, you have to have it free so it can do what it's supposed to be doing, telling your body what it's supposed to be doing. Totally understood that. When he told me that and why they do what they do, I'm like, that makes sense. But the thing that also moved me is they don't just stop with that. They go into nutraceuticals. So if you're having fatigue, or like for me, I had thyroid issues, well, then they had things from a nutraceutical standpoint instead of pharmaceutical standpoint to help elevate my thyroid to get it working. And while we were doing that, then we would talk about other symptoms, and he'd throw in something else, which was incredible. So the first couple months, I started making huge strides. It was awesome. I mean, I remember sitting down with my mom going, and she looked at me and she goes, "You're doing good, aren't you?" And I go, "I am actually happy. I don't think I've been happy." And it is a feeling, that it's a euphoric feeling to be happy. And I'm like, I don't remember the last time I was actually happy. And she goes, "I can tell, you feel good, you look good." And then we put me on a cleanse. And so I get done with the cleanse, and looking at Shane going, "I don't like you." And, but I knew, you had, the damage that had been done to my liver from all these things, every time we mess with my liver, it's just a horrifying thing. So I went down again, I had all the symptoms again, it was, and then 4 weeks went by, and then we went and decided, or maybe it was 2 months, another 2 months. And then we got past that, and I started to feel great again. Everything's awesome. And then we did labs, and it turned out that I have a parasitic issue. So here we go with killing the parasites. And Shane, he's telling me, he goes, "Well, there's been a couple people that they just go down." And I'm like, "So I'm going to be that person?" And he's like, "Maybe not." And I'm like, "No, I know it." And sure enough, a couple weeks into it, it's like, oh, dear Lord, I can't do this again. I can't do it again. But I got through that, and that was 4 weeks ago. And true to the way this has been for me, I am now getting back to that point of feeling good. I mean, this last week, and that's it. It's a day to day. I will feel better and better. And Shane had explained it to me. He goes, "This is how it works. You will have a day, and you'll be like, oh, this is great. But you'll have the dips. But your dips get less." And that was exactly, and that has been the case every time. Every time. And I'm so grateful, and I have no doubt that by the time I am done, I will be well and healthy, and I will feel good, and I will be better than I've ever been. I have if you would have asked me 5 years ago how long was I going to live, and the thought of living to be in my 60s was almost scary. To live sick is a horrible feeling, but I have hope now that I can live to be 90, and I'm excited for that, just so excited. So.